talk to Tony on line 1. Tony, what's up, buddy?
Good morning.
Good morning.
I have one question and one comment.
What's the question?
The question is the amount of sleep. You know, a lot of people have now what they call sleep apnea. And that seems to be something that's being brought to the forefront now, that it's curable, or at least it's something you can put up with. So maybe you can address that a little bit and give us some insight whether an amount of sleep is necessary, how much, and what we can do if we have this sleep apnea.
All right, Thanks for that, Tony. Which one? Let's take amount of sleep first.
Yes. So there were actually a couple of different things that was coupled into the sleep and sleep apnea. I'm going to go with the sleep apnea first. So people think that sleep apnea means not getting sleep. It is actually a respiratory defect, a breathing defect during sleep is what's called sleep apnea. So let me explain it. And most often seen in people who are overweight and obese and alcoholics. And we'll talk about how alcohol leads to sleep apnea. When you're obese, what happens is the soft tissue inside your throat is very lax, and the tongue is usually larger, and when you lay back, it closes your upper airway. So it just basically shuts the exchange of air. The good air cannot get into your lungs, and the bad air builds up in your lungs. And what this does is it's almost like a fire alarm going off several times an hour in your system. Sleep was designed by the Creator to give all your internal organs rest so that it can then rejuvenate and get back to work when you wake up. But if you're having this oxygen and bad air cut out, the bad air is not able to get out and the oxygen is not able to get in. And it's, as I said, like a fire alarm. So your body goes into a crunch state. Every internal organ is working much, much more harder during the night when they're supposed to rest to keep you alive and sustain activity in your body during this process. So although you think you've been in bed for 8 hours, 10 hours, 12 hours, your body has been working several times. So when they do the sleep apnea test, they will tell you how many times you had apnea an hour. Some people have 30, 40. There's only 60 minutes in an hour. Just imagine if so many times your body went into a fire alarm state. How would you feel when you wake up? You would feel like something hit you. You would feel very tired. You will drop your metabolism. You will keep packing on more weight. You'll be very less productive at work. And this is what sleep apnea is all about. But there's a root cause. The root cause is what I told you, 2 things: weight and alcohol.
I've been on apnea since the 60s on the machines.
Okay.
I have one machine that's set for 10 pressure and the other one for 9. And I'm wondering, I haven't seen a doctor for my apnea now for about 25 years. Should I try to change it now that I'm older?
Absolutely. Yes, you may have changed your weight, and there are so many changes that can require lesser or more pressure. So absolutely, yes, it needs to be titrated.
Hey, Al?
Yes?
You know, I got to be honest with you here. You know, obviously you can go see Dr. Tilak if you're in Highland or wherever you live.
Where's she located?
She's on 45th, right across the street from the Strachan Van Til's new building there. You know where that is?
No.
Yeah, you know where 45th in Indianapolis is?
Yeah.
You know where Christensen Chevy is?
Uh-huh.
Yeah, across the street from Christensen Chevy.
Oh, okay. I'll look for her.
Okay, but hold on a second, Al.
Yeah.
If you're going to go, you have to expect that she may point out things that you're doing that you may have to change. Are you okay with that?
I'm 86 years old. Do I have to?
No, then you may be able to teach me what things are doing well. It's this is called co-production. I work with my patients. We produce this effect together. It's nothing that I say that you should do. We do it together.
All right, Al. Thanks a lot, buddy.
Thanks for letting me call.
Is that a typical client?
Yes. Yes, it's great. I mean, those are the people that I love to see. They have so much of wisdom. Their experience teaches us. It humbles you, actually, and makes you a better person, a better doctor. I listen to them. This is something that my mother taught me. The first thing that you have to learn as a doctor is to listen to your patient. 90% of the story is already told from their history. The test is just to prove what your intuition is from what you have heard from your patient.
There you have it. medical practice has just been summarized in a 20-second little bit there by Dr. Mary Tilak. Thanks for coming in.
Thank you.